Good afternoon, everyone. I would like to welcome you to our press briefing as we will receive updates today on COVID-19. As of this morning, we've lost almost 150 of our citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we will hear from City of Albany Mayor Mr. Bo Duro. Mayor Duro will be using his time today to speak on another issue today, and we'd like to invite the mayor forward for some comments. Mr. Mayor.
Good afternoon. Thank you, Chief. I would like to take this opportunity to address an issue which has resurfaced since the death of George Floyd and is now on the minds of all Americans. We, as a nation, watched in horror as a police officer, sworn to protect the lives of citizens, placed his knee, supported by the full weight of his body, on Mr. Floyd's neck for almost 8 minutes. He continued to do so as Mr. Floyd first said he could not breathe and then pled for his life. This officer did not release Mr. Floyd, even though bystanders implored him to do so, and even when Mr. Floyd could no longer speak or move. We were all sickened to watch the video, as we could only question how this police officer could so dispassionately take another man's life, and why the other officers did not intervene to stop this senseless killing. Most disturbingly, I believe, is that we watched the video knowing it would conclude in yet another death of a black male at the hands of a white police officer. The way we have responded tells us much about ourselves. Some Americans, confident that claims of pervasive police brutality are unfounded, were shocked. Some, like myself, were heartbroken, and I must concede, apprehensive about what would follow. And then millions of Americans who have been treated differently because of the color of their skins for their entire lives were justifiably outraged. I understand that the response of many Americans is fueled by a frustration that our government does nothing. Following the beating of Rodney King in 1991, and the unrest following the killing of Michael Brown in 2014, there were promises of change. The response of civic leaders and elected officials is to implore African Americans in positions of influence to assure protest do not escalate into outbreaks of violence. After the crisis passes, the systemic problems which fuel the unrest, poverty, suffering, and for some, hopelessness, endure. I would like to address 3 topics. First, I will summarize what the City of Albany has done to assure that this does not occur in our city. Second, I will briefly discuss the strides the City of Albany has made. Third, I would like to make some observations as to where we are and how we might make further advances. Chief Pursley has kindly educated me on the policies implemented by the Albany Police Department on the use of force. First, he explained officers understand that they have a duty to protect the safety of individuals being arrested and individuals who are taken into custody. These officers are trained to use physical force only when and only for so long as is absolutely necessary. Chief Pursley informed me APD officers understand certain control maneuvers, such as a chokehold or hobbling, which refers to placing a suspect on his or her stomach after being restrained with handcuffs, are unacceptable. This is because these techniques are known to cause the person in custody to asphyxiate or suffocate. Secondly, Chief Pursley informed me that officers receive continuing education to prepare them for dealing with uncooperative and even belligerent subjects. Research has confirmed most conflicts can be resolved peacefully when law enforcement engages an irate subject with a calm demeanor and restraint. De-escalation is the process whereby the use of physical force is postponed until it is clear that the individual encountered by the officer will not comply. Third, Chief Pursley informed me that the city frequently declines to hire applicants who, in the screening process, appear to have some traits which might impair their ability to exercise restraint when confronted with insult or even threat of violence. This is one reason, according to Chief Pursley, that APD has difficulty maintaining its force at full levels. The chief has declined to hire some applicants who are considered questionable, even though elected officials, such as myself, have pressured him to hire more officers. The wisdom of Chief Pursley's approach is apparent when one considers the significant decline in the number of complaints of excessive force logged against officers of the Albany Police Department during his tenure. Fourth, officers who have been found to have used excessive force in the exercise of their duties have been terminated. One such incident occurred a few years ago when an officer violently threw a young man who had been stopped and was suspected of ingesting a controlled substance to the ground. Parting the Waters, the first book in Taylor Branch's trilogy of Dr. King's career, has several chapters which recount events that occurred here in Albany during the early 60s. Mr. Branch was awarded a Pulitzer Prize for this book, which far too many of us have not read. One cause of the initial protest in 1961 was the refusal of our city commission to hire African American police. The request was that these officers patrol South Albany. Washington Long was hired by the city as a police officer in 1966. He was, as you may remember, named as the city's first African American police chief in 1987 and served with distinction in that capacity until his retirement in 1994. Today, over 2/3 of APD's officers are African American. Today, anyone who pleads guilty or is convicted of a felony in Dougherty County will be sentenced by an African American judge. This is true if that person's case is pending in the Superior Court of Dougherty County or the United States District Court. Our district attorney and police chief are also African American. Though we as a city and a society have made progress, there is no question that there are great disparities between white and black. Most of us would, with some embarrassment, acknowledge the officers who encountered George Floyd would almost certainly have conducted themselves differently had a white man attempted to pass a counterfeit bill. Fundamental racial inequalities are evident in the number of deaths from COVID-19. In 2017, the median household income for white families in Albany was $54,500, while the median household income for African American families was $29,600. Over 38% of African Americans in our city live in poverty. Statistics confirm the chances of an African American being charged with resisting arrest are exponentially greater than that for whites. We are generally familiar with the disproportionate number of blacks who are incarcerated, an experience sometimes described as the school to prison pipeline. I am concerned about what some refer to as the militarization of police. I have seen firsthand the absolute injustice wreaked upon young men and women by mandatory minimum sentences for drug offenses. I have proposed and will continue to propose construction of precincts in South and East Albany to facilitate a return to community policing, whereby the relationship between citizens and law enforcement is forged through day-to-day interaction. I am also advocating the purchase of 90 body cameras, which, according to Chief Pursley, would be sufficient to equip each officer with a camera during their respective shifts. This would provide greater accountability and improve public confidence in our department. We must, as a city and a society, address and acknowledge the fact that the events of the last 10 days, though ignited by a specific event, are fueled by conditions and circumstances that are long-standing. Dr. King's observation that riot is the language of the unheard has been quoted time and time again in the last few days. That statement, taken in context, emphasizes the violent protests Dr. King was referring to were the consequence of our country's failure to hear the plight of the Negro poor, which has worsened over the last few years, and our country's failure to hear that the promises of freedom and justice have not been heard. Dr. King observed accurately, large segments of white society are more concerned about tranquility and the status quo than about justice, equality, and humanity. I despair that these solemn words continue to be true today. I understand it is not sufficient for any elected official to simply say there will never be another unnecessary death at the hands of a police officer. While I understand the men and women in uniform are frequently required to make difficult decisions and often must take instantaneous action, and while my sympathies or support are with law enforcement, I know we, as a city and a country, can and must do better. Thank you.
Thank you, Mr. Mayor, for your comments today. We will now hear from Dougherty County Commission Chair, Christopher Cohilas. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by acknowledging those families, and we now have 149 people that have passed in this community due to COVID-19. And I want to really focus us on that issue or current progress as it relates to COVID-19. And as always, we extend our most sincere condolences to those families. And while we have lost 149 too many people, we have not lost a single life in the past week. And that is something that is tremendous and to be thankful for during what has been a very, very trying time. That is phenomenal progress that we as a community have achieved. While there's so much chaos going on in the world, this community, Albany and Dougherty County, has performed in an outstanding fashion with tremendous, tremendous adversity against it. And several weeks ago, I stood before you and I said, we were literally ranked number 3 in the world in terms of per capita infection. And we were seeing numbers and numbers and numbers of dead persons, dead citizens, dead mothers, dead fathers here in this community just grow and grow and grow and grow. And now that literally for the past 7 days, we have not lost a life. And that is something to be thankful for and something that I want us to focus on. And I really want to focus us on some of the things that we're going to be going through. And as we transition and move forward, we have, I want to announce as an additional positive thing to be thankful for, we received an additional 31,000 masks from the governor's office through GEMA. So that we can continue our efforts to mask up citizens in Albany and Dougherty County. And I want to pay special attention to that and talk about how we are operating versus how other communities are operating. Some citizens within this community have the ability to travel, and they have traveled and perhaps observed some of these other communities. Other citizens may not have that opportunity and be able to view the different bubbles that are out there. But I have to tell you that our community is very unique. And I do hear people that complain and say, oh, not everyone's wearing a mask, or not everyone's doing this, or not everyone's doing that. Well, let me just say this. In comparison to the rest of the state of Georgia, I would say we're doing pretty outstanding. If you see these other communities and the rates at which they are or are not wearing masks, or the rates at which they are or are not social distancing, it pales in comparison to what our citizens, our community, our businesses, our leaders, our industries, our churches, all of our citizens have done here through tremendously trying times, and we have continued to flatten the curve. And we've done it through partnerships, as we've done it through our community partnerships with Phoebe, the tremendous efforts of the healthcare workers there. And I want to brag on our first responders. I really want to brag on them, because a lot of times I think people can get caught up in negative self-talk, and I don't think that people always recognize and understand and appreciate how phenomenally blessed we are to have the citizens, to have the employees, to have the healthcare professionals, and to have the first responders that we have here in this community that many other communities don't. And just so that everyone understands, our emergency management agency, which has been tested time and time and time again, from hurricane force winds on January 2nd, 2017 to an EF3 wedge tornado on January 22nd, 2020, to a hurricane scare with Hurricane Irma that turned into a tropical depression, to many other scares, to then Hurricane Michael, and now a pandemic. I would dare say that no other emergency management agency in the entire state of Georgia that's comprised of all the different, the EMTs, the firefighters, the police officers, all the different folks that work there. I would dare say there's not another emergency management agency in the entire state of Georgia that has been through what they have been through over the past 3 years. And then you literally say, okay, we're going to give you a pandemic. Not only are we going to give you a pandemic, we're going to give you the highest dose in the entire nation. You're going to be number 3 in the world, and you've got to respond in this little old town of Albany and Dougherty County. And you know what? They've worked hard. They've worked tirelessly. They have coordinated a tremendous amount of resources. They have helped us access tremendous amounts of resources. These other communities have not gotten shipments of masks. They haven't gotten a COVID surge facility. They haven't gotten National Guard medical teams to come in and fight infection and address specific issues at nursing homes. We have been able to access all of the things that we've been able to access here in this community because of the partnerships we have built and the tremendous hard work of citizens and employees that love this community. And I want to recognize a lot of their hard work today, because our emergency management agency and operations center literally serves as a point of distribution for Region K of Georgia, which is each region of the state of Georgia is broken up for emergency management purposes into different groups. And that's a 17-county area. We receive here in this community supplies for Columbus, Tifton, Valdosta, and to distribute to the various counties in their areas. In total, we're receiving supplies for 42 counties, including PPE, thermometers, and testing kits. I think we've received over 12 million different pieces of different supplies that we've not only helped coordinate for this community, but for the entire region. And I want to say that is an awesome responsibility, and I want to extend a very sincere thanks to our emergency management folks for their hard work in being able to do that. Because not only were they given a very, very hard task, and we still have to continue to emerge through this process, but what we do know is we have seen the darkest days. We've moved through them, and with maintained vigilance and diligence, we'll continue to move forward. We're seeing a different world than we saw 4 to 6 weeks ago. And you're going to hear us talking about different things as we move forward through this crisis. Some of the things that we're going to be talking about are antibody testing. That is something that I anticipate we're going to have here in this community. One of the discussions that I've been having, along with the mayor and several other leaders, is we've requested from Augusta University to come into our community and test an appropriate cross-section of our citizens so that we can make a determination as to how many people have been infected and actually gotten over the virus. Because a lot of times people can be reactive and think, oh my gosh, oh my gosh, oh my gosh, it's so horrible, it's so horrible. There's so many people that have so many numbers. Well, in actuality, when you view things in terms of the virus and in terms of immunity, while we don't have very, very clear answers on whether or not you're absolutely immune once you have had the virus and you've moved past it, we do know from the medical professionals that I've talked to that there's a high likelihood that there is a significant, at least, component of immunity that likely exists for most of those citizens that have been through it. And we also know that there's a significant number of people who have gotten the virus, dealt with the virus, never knew that they had the virus, and likely have attained some level of immunity. So when you're actually assessing whether or not you're able to go out and be more safe and more comfortable with less anxiety and being able to conduct commerce, business, industry, eating at restaurants, going to church, dropping off your children at daycare, and those types of decisions, what's important is to be able to have true data, actual analysis. And one of the things that we're going to do, and one of the things I'm going to talk about, is the concept of herd immunity. And I've read a lot about it. I've asked a lot of questions of the medical professionals, and I'm not a medical professional myself, but I ask questions of the experts who work in the field. And the concept of herd immunity is an important one, because once your community reaches a certain level of infection and having gotten past the virus, that means you actually, as a community, have a far lower risk of infecting people, because you have so many people that have actually established immunity and they've already had the virus, that it's very, very difficult to actually pass the virus on. So making the determination as to whether or not your community actually does or does not have some form, level, or component of herd immunity is something that is very important. And so what we're going to be doing with the cooperation of the City Commission, the County Commission, and the School Board, is getting some testing from Augusta University to test for the specific antibodies and the specific long-term immunity markers, so that we can make a determination as to what percentage of the community do we think likely do or do not, or may or may not have actually had the virus. And we know that the initial influx of the virus was very significant in our community, and that a high level of people were actually infected and hospitalized. Thankfully, we have been able to flatten that number. The number of people that have been hospitalized has greatly gone down. The number of people on ventilators has greatly gone down. The rate of death has greatly gone down. And that's been due to the various different measures that we put in place, the state put in place, the resources we've been able to access, so that we could slow down that process. But what we do have to do is figure out how we continue to move on with our lives. Because I will say this, and I've said this before, we cannot continue to be paralyzed in fear and have negative self-talk in this community about ourselves and how we progress. Because I've heard it from other communities where they say, oh my gosh, you're from Albany, it's like the Black Plague. Well, that's not actually true. We had a horrible set of circumstances. We had all of the cards stacked against us, and you know what? We flattened the curve. We did what we did in 2017, twice what we did in 2018 with Hurricane Michael, and we've done it through the pandemic. As we worked together, we came together, we did what we were supposed to do. And sure, there were some people that didn't follow directions, or some people that didn't all follow the rules. But you know what? Overall, on balance, we've done a darn good job. And we want to, and I want us to start changing the way that we think about ourselves, because I absolutely cannot stand when people want to cast us in the light that, oh my gosh, it's Albany, and they have the plague, or they have this, or they've got that. You know what? We've done an outstanding job. An absolutely outstanding job. And I say we, I don't mean like the people that stand up here at the podium. I'm talking about the doctors, the nurses, the EMTs, the firefighters, the police officers. Those folks, the community members, the business members that have helped us flatten the curve. We've seen people get more creative here. And I'm telling you, like, when I get calls from across the state and across the country asking us how we have done what we have done. And that's a very good thing, because other communities are literally looking to replicate what we have done here in this community. And so what I would say to everyone is this: we need to concentrate on shifting our self-talk. It is we have a reasonable environment to go out and engage in business as long as you follow the rules. Social distance, wear a mask, wash your hands, sanitize. If you're medically fragile or you're in those at-risk populations, continue to shelter in place. But I'm very thankful that feeling of panic in me, and I feel it with the people that I talk to. It's nowhere near where it was. And I think that we need to take some time, be thankful for what we have achieved. And I'm also thankful that in spite of the tremendous chaos that's going on in the world, and obviously the horrific and tragic murder of Mr. Floyd, which is absolutely inexcusable, and the many, many emotions that are surrounding that, and the people that are rightly outraged, and the people that have made peaceful protests and are exercising their rights, mostly in a positive way. I'm thankful that even in the midst of all the chaos that we've had here in this community, I'm thankful for the relationship that does exist between our law enforcement and the citizens. I'm thankful for the fact that we have community-minded first responders. I know these police officers. I know these police chiefs. I know Chief Johnson personally, Chief Pursley, Sheriff Sproul, and you know what? I've been thankful during my time in office, and even when I was at the district attorney's office. I'm thankful for being able to see the relationships that have been built within this community, and the fact that we had peaceful protests in our community, and police chiefs that showed up and actually brought bottled water and made sure that it was a peaceful exercise in a completely appropriate fashion on a completely appropriate subject. And it was handled with peace, dignity, and grace. Because that's how a relationship between first responders, law enforcement, and the community should absolutely exist. And I say this when I was across the street and in the district attorney's office, I was part of a team that ended up having to indict 7 different police officers in 1 year when we had a problem at the police department. And we had some issues there. And I was part of the team that helped work through that. And I'm thankful to see the growth that we've had in our community and the dedicated men, the honorable men that we have in law enforcement that have truly forged relationships with our community, our citizens, our churches, and have built trust. Because the distinction between the communities where you have absolute chaos and this completely toxic relationship between law enforcement and the citizens are areas in communities where there isn't trust. And you have that here, and you don't have chaos. And that's a testament to those men, their leadership, and the first responders that have helped us not only with tornadoes, hurricane-force winds, hurricanes, but a pandemic, and with calming the minds and spirits of many citizens in this community who certainly are feeling what's going on across the country. Thank you.
Mr. Chairman, thank you for your comments today. We will now receive an update from Phoebe Putney Memorial Hospital. Dr. Stephen Kitchen is the Chief Medical Officer. We'll ask him to come forward for some remarks. Dr. Kitchen.
Thanks, Chief. I'm very pleased and happy to report today that many of the favorable trends that we have observed over the last several weeks with regards to the impact of COVID-19 in our community, and specifically what we have observed at Phoebe Putney, these trends continue at this point, and in fact are even more indicative of the fact that the impact of this virus in our community continues to diminish at this point. So it brings me great pleasure to share with you today that we have truly reached, I think, several very, very significant milestones. By that I mean, for the first time since this worldwide nightmare and pandemic began, over the last 24 hours, we have had no patients admitted to Phoebe Putney with COVID-19. And like I say, that's the first time since the early part of March that we have had no patients who have required hospitalization in our community. Also, another, I think, very significant milestone is presently at Phoebe Putney Memorial Hospital, what we refer to as Phoebe, Maine, there are no patients with COVID-19. We've had a very intentional effort working in concert with the governor's office to stand up Phoebe North as a COVID-19 facility. So our numbers are down to a total of 39 patients at this point with COVID-19, and all 39 of those patients are presently housed at Phoebe North. We have spoken about the fact that of our 38 ICU beds at Phoebe, Maine, for many, many weeks, all 38 of those beds and additional ICU beds were totally designated for caring patients with COVID-19. Yesterday, for the first time, our last intensive care unit had no patients with COVID-19. Today, we're doing a very, very extensive cleaning of that intensive care unit. And like I say, we will be able for the first time to really have no patients with COVID-19 who are in our intensive care units at Phoebe, Maine, and all these patients are currently at Phoebe North. So, like I say, we're at a historic low in terms of the number of patients with COVID-19, and that number is currently 39. I'm going to refer to a couple of the graphs that you see. So if you look at new patients hospitalized for COVID-19, that's listed as Phoebe in Albany. And these are our statistics over the last month. In terms of the number of patients admitted on a daily basis for now over a month, we have been in the single digits. Basically, most of those numbers are 6 or less. And I want to remind everyone, when we were in the peak of this pandemic, we were averaging 40 to 45 patients a day who were being admitted across our health system with COVID-19. And then, like I say, yesterday, for the first time, or over the last 24 hours, we've had no patients admitted with COVID-19. I would like to elaborate a bit more and say, you know, this has really been not only our dedicated employees and staff, but working in concert with the city, with the county, with the state. And again, I would like to acknowledge the monumental efforts that have been put forth by our first responders as well, because this has truly been a community effort, and it's been a mutual effort. Again, I can't touch on all the many, many expressions of goodwill that have been extended by our community towards Phoebe Putney, and conversely, I think all the expressions of thanks and forgiveness that we extend on behalf of Phoebe Putney to the many, many countless acts of goodwill that have been extended by all the members of our community at large. A couple of other notable events I would like to touch on. One is regarding our visitation policy. When we were in the height of this crisis in Albany, and when the pandemic was truly raging in Albany, in accordance with the guidelines put out by the CDC, Departments of Public Health, we were at a point where we had to very, very strictly limit visitation into our facilities. This was necessitated for a couple of reasons. First and foremost, the transmission in our community was exceedingly high at that time. And as you have heard, on a per capita basis, we had the highest transmission outside of New York City of any other city in our nation. Community transmission was exceedingly high. We also were severely limited in testing. So if you put those two things together, what we knew was unless we had a very, very strict visitation policy, and again, understanding that many, many individuals who are infected with COVID-19 are showing no symptoms, in the absence of a very strict visitation policy, we knew that we would have a lot of visitors coming in to our facility unknowingly who were infected with COVID-19 and would undoubtedly transmit that to staff, other patients, that sort of thing. We certainly recognize the restriction in visitation is not the approach that we want to take going forward at this point. It creates a real hardship. We fully acknowledge that it severely limits the ability for patients, whether they have COVID-19 or not, to be surrounded by family and loved ones, which is an instrumental part of the healing process. So I think in the very near future, probably within the next week, we're going to have a significant modification in our visitation policy and to allow family and loved ones, whether it's a patient without COVID-19 or with COVID-19, to visit the hospital under some very, very carefully monitored guidelines. And I do want to emphasize the point, this is not going to be all inclusive, meaning that everyone will be able to visit family and loved ones. Obviously, for those in our community who are medically fragile, that would still pose an undue risk to come into the hospital, and similarly for children and visitors under the age 18 and for women who are pregnant who are not coming to the hospital for some medically related reason, we will still need to impose some visitation restrictions. But I think this is, again, a very positive step moving forward and is indicative of the degree of which we have been able to flatten the curve in our community. And lastly, I would just like to state, I think we're all aware of the disproportionate suffering that has been experienced in our community because of the impact of COVID-19. This is a virus, this is a disease entity that knows no boundaries, whether it's based on gender, race, age, that sort of thing. So I just want to end by saying that we fully appreciate the degree of suffering and the loss of loved ones in our community that has occurred. And I think many have said that the most powerful human emotion is that of empathy, of the ability to really understand, to get in someone else's skin and understand what they're going through and their plight. And I can think of no other time it would be more appropriate for us all to take a step back and think about the power of empathy and our ability to find commonality across whatever distinction that you choose to find. So, thank you again.
Thank you, Dr. Kitchen, for your report. We will now move to a report from Public Health. We have the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz, and Dr. Ruiz is also joined by a guest today. He'll invite the guest to speak a little bit later. We'll hear from Dr. Ruiz.
Thank you, Chief. During the last few weeks, I've had the opportunity to talk to a number of people who are trying to get help with getting back to work. These are folks who have tested positive for COVID-19, and in most cases, these are folks who have gone beyond all their symptoms. There's no sign of any more sickness, and with good intent, their employers are requiring 1 or 2 negative tests before they can get back to work. And I want to address that and have a slide. Okay, so Dr. Kitchen took us back to a time in March when things were more hectic and different. And it reminded me that back in March, it was accepted that before a person went back to work, especially in the healthcare field, it was the standard that that person should have 2 negative tests for COVID-19. But as the pandemic progressed and as we learn more about it, the CDC modified the requirement, and for the past month, maybe a little longer, the standard has changed. And so for those who can see the slide, what I want to talk about is the 3 conditions that are necessary for a person to come out of isolation and go back to work after they have experienced a COVID-19 illness. So the first one is that 10 or more days have to pass beyond the first date of symptoms. The second condition is that 72 consecutive hours without any fever while the person is not taking any medicine that might lower the temperature. And then the third is that all of the COVID-19 symptoms must be dramatically improving. So if a person who has been sick with COVID-19 and treated entirely as an outpatient, these are the only 3 conditions that have to be met to come out of isolation and go back to work, regardless of whether the person is in the healthcare field or not. So the standards have changed as time has progressed, and we understand why early on many employers were requiring this goal be met of 2 negative tests, but that is simply no longer the standard. And so we want to make sure that everybody is aware of that. I spoke with someone just yesterday who said that he had a COVID-19 test, and he said that he generally has that test done once a week. And each time he has turned up negative. And there's absolutely nothing wrong with getting repeat tests for people who always test negative. In fact, we encourage people to come out and get a test. But once a person tests positive for COVID-19, in most cases, 99% of cases, there's no medical or scientific reason to get another test. And this is wise because the CDC has come to a conclusion that basically 10 days after the onset of the illness, if there's no fever and the symptoms are getting better, that the person is no longer contagious. And the one thing that also sort of creates some confusion is we know now from experience that even after a person is completely over their illness, the fragments of the virus can persist in their nasal passageways and their sinuses for weeks and weeks. So after a person has overcome the illness entirely, and even after they're no longer contagious, repeat tests many times, in fact, probably most of the time, repeat tests will continue to show the presence of these genetic fragments from the virus, but that does not in any way indicate that the virus is still alive and capable of causing any disease in that person or being passed on to someone else. So we just want to do that to kind of set the record straight. We encourage people to get tests, but if you already tested positive once, there are very few reasons to test again. If you and your healthcare provider believe that another test is appropriate for you, then we would certainly do that. I do want to talk about the opportunities for testing here in Southwest Georgia. And again, these collections are offered in a number of counties. There's no charge to the patient. They are available in these counties over the next 10 days: Decatur, Daugherty, Grady, Lee County, Mitchell County, Terrell, and Thomas counties. And it's easy to set up an appointment. The number is 229-352-6567. We encourage appointments. It helps us to make sure we have adequate staff and supplies, but appointments are not necessary. We will test a person even without an appointment. In Colquitt County and Moultrie at the Colquitt Regional Medical Center, we are working in conjunction with the staff there to provide collections every day except for Saturday. The times there are 9 a.m. to 1 p.m. So again, it's easy to set up an appointment, 229-352-6567. We urge you to get tested if you have never tested positive. And I'd like to reintroduce to you Mr. James Davis. Mr. Davis is the Director of Environmental Health Services here in Daugherty County, and he has just a couple of words to share with you.
Thank you, Dr. Ruiz. Good afternoon, everyone. Let me take this off. As of last Thursday, we began operating up on a new executive order, which is Executive Order 05.28.20.02. And as it relates to food service, the executive order specifically maintains the operating guidelines for restaurants and dining facilities. But what this one does is add guidelines for bars, banquet facilities, private event facilities, private reception venues, and other places where food is served. Temporary food service events, Mardi Gras, Wing Fest, stuff like that, those are still not allowed. As it relates to bars, they are required to screen their workers for COVID-19, taking the temperature, doing a little questionnaire as to whether or not they're exhibiting signs of COVID-19. Workers in bars are required to wear face masks at all times, and occupancy shall be limited to 25 persons or 35% of the total listed fire capacity occupancy for the entire bar, whichever is greater. The bars have to be sanitized twice a day before opening and after closing. And if hand sanitizer is not available, it has to be provided at the door. If it's not available, they shall not be open. If if you have not, if you are a facility up under the Department of Public Health, a restaurant, bar, hotel, if you have not received this, please give us a contact. It was mailed out to all our facilities yesterday. You should have gotten the guidance and a copy of the executive order. So if you have not gotten it, please contact the office at area code 229-438-3943, and we'll update your files and get this information out to you. All right, thank you.
Thank you, Dr. Ruiz, Mr. Davis, for being here today and providing an update from Public Health. I would like to now hear from an update. This is her first time being with us, and we're very pleased that she joined us today to give us an update on the elections that will be occurring in Albany and Dougherty County. We have the election supervisor, Ms. Ginger Nickerson. Ms. Nickerson.
Thank you, Chief Scott, and good afternoon, everyone. We want to update you on the election process for citizens of Albany-Dougherty County. We do know that Election Day is coming. It will be this Tuesday, June the 9th. All precincts in the past, would have been open. Due to COVID-19, we're having to combine some precincts. We are not consolidating and not closing any in the future, but due to being unable to find workers at precincts, the following precincts will be located at the same location. So at the Westover precinct, we will have the Greenbrier precinct, as well as Darton or ASU West, and also the First Christian Church. At the Mount Zion precinct, we will also have Alice Coachman located. At the Bill Miller Center precinct, the ASU West precinct will also be located there. And at the Phoebe East location, we will also have the Turner Elementary precinct. There will be signage posted at all of these locations. Of course, the precinct, the poll workers have been advised they will be practicing social distancing, following CDC guidelines. There will be sanitizer, they will be wearing masks, they will be wearing gloves. Also, we want individuals to know that advanced voting is still going on. It is taking place at the 125 Pine Avenue address. That is the Riverfront Resource Center. Tomorrow at 5 p.m. is the last day. That is 8:30 to 5. After that, there will be no voting until Tuesday, Election Day. We greatly appreciate all of our citizens for taking advantage of the ballot being mailed to their home. That process is still taking place. They're being mailed in daily. We want everyone to know also that there's a drop box located at the front of the Government Center building. That's 222 Pine Avenue. That drop box is under 24-hour surveillance, so please know that it is secure. So once you have voted your ballot, we invite you to come deposit it in that box. You do not have to place a stamp on it, and we will retrieve it. The drop box will be open and available for voters until election night. That's Tuesday, June the 9th, 7 p.m. At 7 p.m., the drop box will be removed, so there will be no box outside at all. We encourage voters to call our office if you have any questions concerning where you vote at, sample ballots. If you want to verify your status on your absentee ballot, we encourage them to give us a call, and we hope that everyone turns out and votes safely. Thank you.
Thank you again, Ms. Nickerson, for being with us today. We will now have an update from Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. I want to say things are getting better. Things are getting better. So when things are getting better, I got to give God the glory for things are getting better. Someone called me the other day, asked me, did I read the swap box about me putting my religion before the people. Let me say this. I thank the doctor, I thank the first responders, I thank the community leaders and everyone that's doing what are doing, but I knew it had to be God to give us the glory, and had to be God to give the doctors the knowledge to do what they do, the nurses, the different ones. So I can't leave him out. I can't do that, because things are getting better. I believe that it's God the one that allows things to be better. So I'm not putting my religion on no one, but I got to give him the praise for what he's doing. At this present time, I got some good news for you at the end. I'm going to show you. We have 149 deaths in Dougherty County residents here in Dougherty County. And I'm going to give you a breakdown. In 31721, we have 19 deaths. 31707, we have 31 deaths. On the east side, 31705, we have 30 deaths. 31701 on the south side, we have 69 deaths. We have a total of 82 females. We have a total of 62 males. We have 1 Latino. We have 32 whites. We have 116 blacks. A breakdown of that. Then come up, we have a total of 24 white females. We have 8 white males. We have 1 Latino male. We have 55 black males, and we have 61 black females. I don't know what's not, the chart's not showing up there today. But we have 2 up under the age of 20. We have 3 up under the age of 30. We have 8 up under the age of 40. We have 9 up under the age of 50. We have 42 up under the age of 60, in the age of 60. We have 42 in the age of 70. We have 29 in the age of 80. We have 13 in the age of 90, and we have 1 over 100. The average age is 71. The oldest is 104. The youngest is 26. Location of death, we had 113 to die within the hospital. We had 25 to die in the nursing home. We had 11 to die in the residence. Residents of the nursing home, even whether they died at the nursing home or had to be transported to the ER, we had a total of 42 residents from the nursing home and 107 from outside of the nursing home. And this is some of the good news. When we started out back in March of the 15th, we had 10. The next week we had 16. Week 3 we had 27. Week 4 we had 26. Week 5 we had 27. Then it dropped down on week 6 to 7. Then it went up to 13. And you can kind of see the bracket, how we are doing better. Week 8 we get at 5. Then it dropped to 8, went to 6. Last week we had 4, and of this week we have 0. We had no one to die this week. There was no death in the last 7 days. In the last 7 days, no death. So that's why I say I have to give God the glory for allowing it to be this way, because, I mean, I think for the first responders and everyone that doing the job they've done an awesome job, and the firefighters, the EMTs, but it's getting better. I know a lot of times we tell you the bad news, but the good news is it's getting better. And I want you to keep practicing social distance, keep wearing your mask, and keep doing what we're doing. I think, like our chairman and our mayor said, our community have went through a whole lot. We've survived, and we've made it thus far. So let's keep pushing forward and looking for a better day. This is a good day, but it's going to get better. Thank you.
Thank you, Mr. Carter, for those remarks today. We'll pause now for any questions at this point. Any questions today? Okay. We'll remind you of the number to the Emergency Operations Center if you have any questions on the governor's orders or need access to numbers, to resources and testing, you may call the Emergency Operations Center 7 days a week from 8 a.m. to 5 p.m. at 229-302-1900. It's 302-1900. That is also the number you would dial as well for any compliance issues that you may see throughout the community. We're standing by to assist you with that. Our next press conference will be next Thursday at 1 p.m. We've moved to press conferences now once a week, and we've settled in on Thursday at 1 p.m. And as we end today, I will again remind you to mask up Albany, mask up Dougherty County, and we'll see you next week. Thank you very much.